Hello, everyone. Ashley with Mari. So I know it's been a little while. Things have been a little bit nuts with the holidays and all the surgeries. But I want to talk today about something that is a very, very common stressful thing for you guys out there who are getting surgery, who have had surgery, things like that. So, botched. Yes, there are shows about it. Yes, there are a lot of people who like to cling to the idea of, oh, I was botched. There's like the whole drama around it, right? The same way there's the drama around, getting surgery in the first place, or Botox or fillers or things like that, right? It's become a less discreet thing nowadays, which means there are a lot of more misconceptions about healing, about what it actually entails to get surgery, lots of stuff like that. So let's talk a little bit about it. So what does being botched actually mean? Now, I know you guys go through surgery and it's a very, emotional thing. But being botched is not something to take lightly, and it's not something to just claim. It's kind of like, and this is an extreme, saying like, oh, like, well, I have cancer. Well, that's not something you kind of just throw out there. The same way you don't just go in the plastic surgery room and be like, oh yeah, I was botched. Like, no, that's not a good thing. Like, you don't want to bring attention to that. So when you're talking about being actually botched, that is something that happens on the surgeon's end. That is not something that is just kind of like, boop, overnight, there's a problem with my surgery. Now I look like messed up forever. That's not how that works. So when you're actually botched, it is a structural thing that can't just lightly be fixed. It's something that is like really, really, really wrong. And you know it. Like there are people who will get breast implants or breast augmentations and like the scar is like a J instead of like a straight line. It like curves. Or your tummy tuck scar, one side is severely higher than the other. Not just like a little bit, but like totally crooked, or something crazy like that. So you would know. It's one of those things that like if you were botched, you would know. But let's go through this anyway. First of all, everybody who's had surgery, who's just come out of surgery, who is getting ready to have surgery, I'm going to need you all to just take a nice deep breath. I get there's a lot going on in your head. I get there's a lot going on in the world in general, on top of you worrying a lot about if you're going to come out okay, sometimes even second guessing your doctor, which I don't suggest that you do. Guys, if you choose a doctor that you're happy with, just be happy with that doctor and trust them. The aftercare is a different story. Doctors are not obligated to hold your hand after surgery. Their job is to do the surgery, and that is it. Their job is not to check in on you every day. Their job is not to make sure your swelling is going down. Their job is not to, do any of the recovery stuff, monitor what you're eating at home, give you a food or diet list. That's not their job. Their job is to do the surgery, and that's it. At Amare, we are a full-service recovery center. Our job is to teach you how to eat, to teach you how and when to wear your garment if your doctor didn't give you enough instructions, to teach you what exactly you need to be doing to take care of your incisions so they minimize scarring or don't scar as much. We have tons of videos on all of these things, but that is our job at Amare as a recovery center. Your doctor's job is just to do the surgery, and that's it. So how do we know if we're botched or not? Well, like I said, it's one of the things that you know. After 6 months of healing, you know. Now, everybody says that like, oh, it takes 6 months to a year to see your results. Well, when you're getting actual post-op care, it doesn't really take that long. It can be, anywhere from 3 months with your healing to 6 months, and then you're really like done, completely done. Sometimes we have, video about garments and things like that. Sometimes you're out of your garment a lot sooner than that. Sometimes you're out of it after, 2 weeks sometimes if you're just doing a little bit of lipo. Anywhere up to, people on YouTube, influencers, people that have no idea what they're talking about, who just had surgery but have no actual guidance will tell you, oh, I wore my surgery up to a year. Oh, my faja has to be like super, super, super tight. And I make sure that I wash mine all the time so it stays super tight. Guys, that is not okay. Just because you hear somebody say something, if they're not a professional, if they are not your doctor, if they are not taking care of you, please do not take that as medical advice. It is not medical advice. They are not a professional. Now, we at Amare are technically massage therapists, but we're certified and specialized in post-op. So the things that we say are from experience, are from knowledge, are from actually being certified and trained to do this kind of work. So when you're looking for guidance, you come to a professional. Don't just listen to people on the internet, which is also why you don't listen to people on the internet about whether you're botched or not. Because then you're looking at all of these, crazy videos of people who just have fibrosis, that just have scar tissue. They're not botched. They don't know what they're talking about. They just go crazy with all the worry in their head and like to make a big drama and a big deal around it because that's what they do. So again, take a nice deep breath real quick. and chill, because you don't know that you're botched. That's not for you to say. You can say, I don't like the way this looks. You can say, this doesn't look right to me. You can call your doctor and be like, hey, is it supposed to look like this? But don't go around telling people you're botched. Don't go around telling people your doctor did a bad job, or your doctor's the worst, or your surgery was horrible. Like, leave your doctors alone, guys. It's not your doctor's fault if you don't take care of yourself. And yes, that is a big thing. Now, should you be advised on how to take care of yourself? Yes. Is that your doctor's job? I mean, kind of. Again, your surgeon's job is just to do the surgery. Your surgeon's job is not to hold your hand through the whole thing. It is your job to do the research to figure out what you need to do to take care of yourself. Somebody who has Lyme's disease, somebody who's had cancer before, somebody who has lupus, fibromyalgia, MS, any kind of autoimmune disease before surgery is going to have a hard time healing. There's a reason some doctors won't do a lot of things on certain people, because it takes a lot on your body when you get a kind of surgery done, whatever plastic surgery it is. It still takes a toll on your body. It's still surgery. So if you have pre-existing medical conditions, it's your responsibility to go and find the proper care, which is, what we do, is creating a tailored, customized plan for you guys, for your recovery, whatever your conditions may be, all that stuff. But that is your responsibility, is to do your research. Your doctor is not obligated to do that for you. That is completely on you. So no matter what the surgery is, no matter what, even after knee surgery, even after something cosmetic or, medically necessary, whatever it is, it's your job to do that kind of research and figure out what you need for you. And I mean, think about it, guys. Doctors and surgeons see people all day, every day. There is no way they're going to be able to pick through your entire medical history and tell you, okay, this is what you're going to need. They are so busy working on you guys doing the surgery. And I know a lot of doctors that refer out to us that will tell you, yeah, it's your responsibility to get your lymphatic drainage done. It's your responsibility to find a properly trained MLD therapist to get this done. Now, there are a lot of us out there. Not a lot of them specialize in post-op, which is why we do, which is why we're bringing you guys all this stuff. But again, it's your job to kind of figure out what you need and what you don't need, and what you want and what you don't want. So we'll start with that. So saying that you're botched, that's something for your doctor to say. That's not something for us to say. That's not something for you to say. That is strictly a doctor thing, because what that means is something in the surgery, either one, happened that was not talked about because it was medically necessary, or two, the doctor, you told him it was okay to take creative liberties, and if he saw something that could have been done better than what you guys originally talked about, he did it. Or three, maybe he couldn't do what you wanted when he got in there. Maybe there was something different that happened, or he or she, maybe there was something different that happened that needed to be done, like they couldn't take out as much lipo from one area because it would sacrifice all the other areas you guys talked about. Or they couldn't do the tummy tuck scar that way because your skin wouldn't come out looking right and it wouldn't look as natural as you asked them to. There are tons of things that could possibly happen. But guys, stop blaming your doctor. Stop pointing the finger at your surgeon. Stop saying that you're botched 3 weeks into surgery, like 3 weeks into recovery. Just take a breath. Take a breath and see a professional. That's what I'm going to first and foremost start off with. I am not a surgeon. I am a recovery specialist. I'm a manual lymphatic drainage therapist. I have lots of experience with post-op care. I am not a doctor. I am not a surgeon. I can't tell you guys what, it means for your body if you are botched. What I can tell you is, what is fibrosis? What is healing? What is swelling that is causing your scar to look super crooked, making you think you're botched? What is, those hard patches that you get? Are those permanent or are those not? I can tell you those things. I can kind of help you with those. Your concerns about your body after surgery are serious. I'm not saying that they're not. They absolutely are. But throwing around things like saying that you're botched and getting angry at your doctor and saying that your doctor did a horrible job. Now, I do understand that you're not always going to be able to see your doctor right after surgery. I do understand that it's frustrating because you're super concerned about your body. If you have a lot of questions, a lot of guilt, a lot of worries going into the surgery, it's going to make your recovery so much harder. Because unless you have somebody on your side, on your team, like us at Amare, you are literally on your own. Because your doctor is there for certain things, for certain questions. The nurses are there to check your incisions and do the medical doctor stuff. But if you're alone and it's just you and the internet, you're going to go crazy thinking you have something wrong with you. And we see it all the time, guys. You come into my office in tears. Just because you have no reassurance, you're alone, you have no idea what you're supposed to look like. You look worse, if not the same as before you went into surgery, and it's 3 weeks out, and you're like, what is going on? So here's the timeline. At week 1, you're still super, super, super raw. You're probably still leaking. You're probably still bleeding if you have drains open. Things like that. There's probably still stuff happening, like like immediate surgery wise. You're still in like, you know, taking the antibiotics, taking the painkillers, that whole phase. So week 1 is kind of like a blur almost, because you're really doing a lot of the healing at that point. So week 2, you're more in like the swelling phase of like, oh, okay, now I can get up and move a little bit more. Now my stitches and incisions and areas where things were done are healing a little bit better. By week 2, if you're having a tummy tuck, you're usually getting your drains out unless the doctor says otherwise. So week 2, we're a little bit there. By week 3 and week 4, or the end of week 2, is usually when it goes downhill for you guys. Why? Because your body on the outside is healed. Your body on the inside is still healing, like a lot. It's a lot of internal invasive work. Whenever we're doing lipo, BBL, tummy tuck, whatever it is, plastics, even facelifts, all that stuff internally needs to heal. Even with the new threads that they're doing, the POD threads, guys, that's in your face. Yes, it's going to look great. Yes, it's in there. Yes, it's, you know, minimally invasive. And their recovery time, I've heard, is amazing. I haven't worked directly with them, but from what I've seen and the research that I've done, and, you know, some of the clients that I've spoken to who've got it done or had somebody who got it done or knows somebody who does it, it's supposed to be awesome. It's supposed to be great. It's supposed to be, you know, for certain people. Not everything is for everybody. We have tons of videos on that too. But it's supposed to be, you know, non-invasive, all of this stuff, or minimally invasive, and it lifts and works, but that's internal, that's in your skin, it's in your face. All that's going to take some time to heal. I mean, same thing with Botox, same thing with fillers, all that stuff takes a little bit of time. So when you're talking about your surgery, it's the same thing. It still takes a little bit of time. Any surgery, we know BBLs are 6 weeks. We know lipo can be anywhere from, you know, a month to 2 months. We know that tummy tucks are sometimes a month, 2 months, 3 months. They're all around the same thing, all these cosmetic surgeries. But the tipping point where you guys are like starting to freak out is when you're at week 3 and you have massive swelling, or your incision's crooked, or it doesn't look the way it did when you first got out of surgery because you were so raw and things internal are starting to heal. I don't have X-ray vision. You don't have X-ray vision. We can't see what's going on in there. But there's a lot of healing going on. With lipo, the cannula is going inside of you, in between that tissue and those layers, and sucking out all the fat. Your body's got to heal all that together. With a tummy tuck, you're removing a part of your body, pulling it down, stitching it back together. All that's got to reconnect. The nerves, the tissue, the skin, all of it. Everything's got to repair and seal up in there, not just on the surface. So when you guys are just looking at it on the surface level, not taking into account that this was a major thing, all of these surgeries should not be taken lightly. All of this stuff is major. It needs to take time. You've got to be patient with it, which is why jumping to I'm botched 3 weeks in is crazy. That's super crazy, guys. I know you're worried. You have every right and every single validation to be worried about your body. It is your body. You spent a lot of money on it. You spent a lot of time on it. You made this decision. It was a lot. But we shouldn't be jumping to conclusions. We shouldn't be blaming people. We shouldn't be yelling at our doctors. They did their job. Your job is to heal. So when we're talking about all these things, fibrosis, the hard patches everywhere, those thick balls everywhere that you get all over the place. If you don't have a proper garment, if you don't have foams, if you're not getting proper manual lymph drainage, not body contouring, not the squeeze thing, not the thing where they cut open your incisions and push fluid out of you, true hands-on manual lymph drainage with a trained professional in post-op. If you are not getting that done, your body's going to take a lot longer to heal. It's going to have lots of road bumps along the way. If you're having salt, if you're not having enough water on top of that, and you're not eating clean during this whole thing and doing the things that are going to support your body in the healing, yeah, you're going to think you're botched because everything's going to look crazy because you're not taking care of your surgery. You have to take responsibility for this stuff and stop going around and yelling at your doctors, because I will have doctors call me because you're yelling at them because you think you're botched because you're not taking care of yourself and the lymph drainage didn't work. Well, no, it's not going to work. We can't make it work if you're not drinking water. Lymph gets transported out of the body with water. If you're not drinking a gallon of water or close to, no, it's not going to really, it's going to go, but it's not going to be as much as you want it to. Same thing, if you guys aren't diligent about wearing your garment, if you're not diligent about not having salt in your meals and making sure that you're eating healthy, no, it's not going to look like you want it to look like. Same thing with a tattoo. I've said this before. If you get a tattoo and you're picking at the scabs or you're not putting like the tattoo salve on it, yeah, it's going to look crusty and crazy. You're going to lose a lot of that ink and it's going to look weird, and then it's probably not going to come out right. You didn't take care of it. You have to do the same thing. You have to do your research. You have to set up a treatment plan. You have to take this seriously. And you have to keep up with your garments, guys. You are going to need smaller garments as you shrink down. You're going to need foams. You're going to need all these different things. Every single body is going to need something different for recovery. That is your responsibility. So before we go crying that we're botched, let's take a look at what we're actually doing to our bodies while we're going through this whole healing thing. Now that that's being said, let's jump, to the point where people are actually botched. So we have clients who they did go through, a breast reduction or maybe even an explant. And during that explant process, something happened. Or I hate to go down this road, but there are some surgeons that are really, 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 really bad. And I mean, we've all heard about them. We know who they are. We're not naming names. There are some surgeons who will claim to do things that can't do things and should not be doing things and are not certified. Guys, there is a big, 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 big difference between being board certified in something and taking a weekend course and getting a certificate. Huge, huge difference. Please research your surgeons. Talk to your surgeons. Make sure you feel comfortable with them. Ask questions. Ask a million questions. If you guys don't know what questions to ask, come to us. Set up a pre-op appointment. We will make sure you are armed and ready with the questions to ask for your body, for your surgery, for your specific goals. You have to be educated about this stuff. So people who are actually botched. So scars, right? Let's take the easiest thing. Tummy tuck scars or breast reduction, lift, implant, all kinds of that stuff that cause scars, right? Swelling will change the shape of your scar. It will look crazy. We have photos on our Instagram before and afters where scars, and I think we have actually a couple tummy tuck ones coming up this month, where the scars look super crooked to begin, and then as the swelling on this side comes down, it evens out, and the skin goes back to being a nice, thin, straight scar. So it's not always that you're botched. It's not always that your doctor's the one to blame. Your doctor messed up, blah, 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 blah. He should have told me about lymph drainage. He should have told me this. It's not about that. It's about you guys paying attention to your body, and that's what we strive to teach you. The very first session you have with me in your post-op, I teach you what you need to look for. I teach you what you guys should be seeing, what you should be expecting. And if you're not getting that, you call me or you call your doctor and you come in to either one of our offices and we figure out what's going on, because then in that case, maybe you did have too much salt and now it's all fibrotic in there and going to take a while before it calms down. Maybe your garment's cutting into you and causing irritation on your incision. Maybe you're not wearing your foams the way you're supposed to. There's tons of things. This is why I say take accountability and make sure you're doing the things at home before you go saying it's your doctor's fault, because they did the surgery. Especially if it's a case where out of surgery, you look great. Everything is perfect. Then 2 to 3 weeks later, you look crazy. Well, something had to happen along the way. Because if they cut you, think about it like fabric, right? If you cut a piece of fabric straight across, when you sew it together, it's going to be a thin line. If you cut it on an angle, or if you cut it straight and then kind of curvy a little bit, when you sew it together, you're going to see that fabric ripple a little bit. Okay, but if you have a piece of fabric with a seam down the middle, and I take my hand and I push on it, it's going to bow outwards. And your scars are going to look kind of crazy, and your incisions are going to look kind of crazy and really thick and really like lumpy almost, because there's pressure behind it from the swelling or from too much salt or from eating foods that trigger a reaction in the body for swelling. It could literally be anything. Maybe, one of your medications is causing swelling. Maybe you're wearing compression socks that are 10 sizes too small, wearing them for 4, 5, 6 weeks after surgery, and you're swelling up all the way up to your tummy tuck incision. Yes, I've seen it happen. It sounds crazy, but I've seen it happen. Maybe your garment's too big. Maybe your garment's too small. Again, tons of reasons. But when we're talking about being botched, you can't even say that until you're at the 6-month mark when you heal. Now, how do we stop that from happening, right? Let's say you don't get any lymph drainage done with us. You go to one of those squeeze people that squeeze the crap out of you. You get all this fibrotic buildup, this scar tissue buildup inside of you, because what they're doing is just squeezing against pretty much like an open incision inside your body. And they're taking their hands, they're doing this over and over and over tissue that's been cut up and making it kind of worse, and then taking out all of the vital fluids that your body needs to heal. and now you're just really, really hard and can't move. And you're like 6 months after surgery, and your lipo looks all lumpy and weird, and your tummy tuck scar is like really thick and keloiding. That's something else, guys. It's not always a keloid. Yes, there is such thing as keloiding, where your body produces a lot of like cells that's a thick, thick, thick thing. But a lot of times it's just swelling behind your incisions. It's not really keloiding. Now, if you're prone to keloiding and you know that, it very possibly could be keloiding, absolutely. But if you've never had a keloid in your entire life and your body doesn't do that and you have no autoimmune issues, it's swelling behind the actual incision itself, causing it to push and create pressure on the scar. That can go away. Now, again, every case is different. So I'm not saying that's your case, but I'm just saying every case is different, and that is a possibility. So when we're talking about all these different things, yeah, at the 6-month mark, when your body's healed and you're hard and you're thick, and at that point you're like, oh, I'm botched. Well, okay, maybe not. Like maybe still, maybe not. I mean, at that point, it's definitely a cause for concern, but if you didn't take care of yourself, you were eating salt, you weren't getting proper lymph drainage done, you weren't wearing a garment the way you were supposed to, and you had no lipofoams, and you were using a board, which traps fluid, by the way, if you were using a board on top of that, yeah, it's going to push all the swelling into one area. The swelling is going to stay there, and it's going to start to congeal and become hard because your body now thinks that that's a permanent part of itself. Because during the healing process, you trapped all that fluid there and held it there. So now your body's like, oh, okay, we're going to make this a permanent part of ourselves. That's where we get into revisions. That's where we get into botched. Because at that point, at the 6-month mark, at the year mark, sometimes we can still get it to go down. 90% of the time, we can still get it to go down. The other 10%, it's where it's been in there for so long, it's a part of your body now. And that is a massive scar tissue, and you have to go get it revised, which is where they do more lipo and suck out that tissue again. And now we're back to square one, where guess what, guys? This time you have to do it right. This time, you have to go get your lymph drainage done. You have to not have salt. You have to have the water. You have to take care of yourself. Otherwise, this is where we get into the people having 3 and 4 and 5 rounds of lipo. Same thing with a BBL. If you're sitting on it, sleeping on it, if you're not taking care of it, if you're not using a BBL pillow, if your garment is crushing it because you think you have to be snatched in your waist, so you get a super tiny garment that squeezes the crap out of your glutes where we just had all that beautiful fat injected, it's kind of the same thing as sitting on it. It's squishing all of that stuff. So even with that, you're not happy with your BBL results, or they didn't do what you wanted. Well, maybe it's not that. Maybe it's that you didn't take care of it, or you didn't have the right care. And again, totally not your fault if you're not educated about it, but it is your responsibility to be educated about it. That's why I do these videos. That's why we have our pre-op consultations, where you guys come in way before surgery, or the day you book your surgery, you then book with us, and we have a pre-op, and we spend an hour talking about your entire surgery, giving you all the questions to ask, talking about everything that could possibly go wrong, pitfalls, how to avoid them, what you need to be doing, how to start taking care of yourself now, so that when you get to your surgery point, where you're actually at like the day before or the day after surgery, you're calm. And you're not freaking out about these things. And you're not looking up tons of crap on the internet. And you're not watching people who have actually been botched on YouTube and playing Dr. Google and trying to figure out what's wrong with you. But it's simply you just not taking care of your surgery because you're looking in the wrong places. Because now you're Googling out of fear rather than out of being proactive. So again, guys, all of this is just about doing your research. And don't jump to say you're botched unless you've done the research, the proper research. Not the people on YouTube who went to Miami and are not wearing the correct garment and stayed in a recovery house where they gave you Campbell's chicken noodle soup and all kinds of crap that they give you there. Or they make you Spanish rice, which is full of adobo, which, hello, has salt in it. Or you taste it and you can't even eat it, so you're eating stuff from 7-Eleven because the food in the recovery house is not edible. Yes, these are real stories. Like, all of that, you're watching those videos, you're watching those people, looking at what they went through, and then pinning that on yourself because you didn't do the research beforehand because you didn't know what you were getting into. You guys got to do the research. And a lot of times, like I said, botched is not really botched. It's about how you take care of it and how you take care of yourself. And that is the major thing with these surgeries, guys, is a lot of people, it's like getting your nails done. You just go and get your tips put on and you're done. You go and get your acrylic done, they paint them, and you're good to go. And that's it. Well, you still got to go back for maintenance, right? Otherwise, you got to get a whole new set put on. You just had surgery. You got to take care of yourself. And yes, your lymphatic massages is part of that, but it's also all the other stuff at home that you got to do. And again, that's not to say that botched is not a real thing. I have seen botched being a real thing, but the word botched is something completely subjective, completely subjective. Unless your surgeon, like I said, something during the surgery did not go right, and that caused something to be botched, or unless the surgeon did something, which 99.99999% of the times is not the case. There are some cases, but just because you're not happy with the way you look at this present moment because you are in the middle of recovery does not mean that you are botched, and there's no reason to freak out over it. If you really do have some sort of a concern like that, reach out to us, set up an appointment, reach out to your doctor, talk to them, call your doctor, see a nurse. And I know it's frustrating me because they don't give you the answers that you want. They don't sit there and explain everything to you because they don't have the time, but that's what we're here for, is to communicate with you and your doctor and figure out what's going on. And we work with a lot of doctors. Sonabello, Elite, Dr. Doback in Miami. We work with Mia Aesthetics, Silhouette, everybody in Miami we've seen. We work with everybody from Miami to Connecticut to Massachusetts, New Jersey, Pennsylvania, New York, all of it. We do all of it. And if it's a doctor that we haven't heard of yet, I will call, or you will call, and I'll give you the questions to ask. There is always an open line of communication. You can always talk to your doctor about it rather than Googling on the internet. And if you don't have support from them, you can always get support from us. So that is the end of my live today. Again, guys, I think we all just need to take a deep breath in these times, give ourselves a minute, check in, see where we're actually at, and reach out to a professional before we go saying that we are botched. Because the people who really are botched are not bragging about it, and they really are trying to seek help. And that is something that they will take up with their doctor directly. So if you guys want to schedule a session, if you have questions, please feel free to call us, 732-841-0142. I hope this video was somewhat helpful. Again, thank you for watching. Thank you for spending time with me, and I will see you guys very soon. Bye!